Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. It is October 24th, 2024. Today we will be talking about retail health. It's getting closer to the election, which means I've put my head in the sand after early voting, but we hope you enjoyed our episode on the topic last week with Ellen Bayer. As a reminder, we are now offering a collection of articles on health-related topics related to the 2024 presidential election. Check out our collections page. You get access to articles, paywalled and open access articles on the topics of drug spending, antitrust, home care, the ACA, and more. And today to talk about retail health, we have back on the program Leslie Erdelack. Leslie, welcome back.
Hey, thanks, Jeff.
Yeah, excited to have you here. When was the last time you went to a retail clinic? You know, HIPAA compliant.
A retail clinic. I can't say I've ever, but that's just me. That's just a personal preference. I thought you were going to ask me when the last time I was in a Rite Aid.
Okay.
Because there happens to be one like right across the street. And I was going to say, I think it was the day after Halloween last year when I got heavily discounted Halloween candy. And I got my calendar marked for this year. So
yeah, that's a pro tip.
Right?
Yeah. I mean, discounted Reese's, can't beat that.
But I haven't yet made it to the clinic. But again, that's just me. I've got my priorities, you know?
I know that's right. Yeah, I went to the CVS Health to get my flu shot recently. Not a big deal, not bragging about it, but I went there. It's down the street. And so today, luckily, that store is still there and will continue to be there, God willing, through the end of days. But the market isn't looking so hot for retail clinics right now. Is that right?
Yeah, there's a lot of headlines.
Yeah, that like just from a top down, we'll get into some more of the details, but like recent headlines from the last 2 weeks have been that Walgreens are going to be shutting down about 1,200 centers. Adding on that, CVS Health CEO Karen Lynch is now out of the top position. And also pulled its earnings guidance and has confirmed about 3,000 in layoffs this month. It's not, you don't love to see it.
Yeah, so let's start with Walgreens, right? So about 1 in 7 Walgreens locations are going to close over the next 3 years. And so that was a decision that the company made so they could really focus on controlling operating costs and helping with their cash flow. So I think the through line with all of these stories, profitability is a huge factor here. For Walgreens, that company was struggling with lower reimbursement rates. Again, I guess a lot of pharmacies are dealing with this, right? A lot lower reimbursement rates for prescription drugs that just haven't been able to be offset through other types of services or offerings in the stores. People tend to buy, well, I guess this isn't me, but people tend to buy their snacks and, Halloween candy and household goods at other places now, for the most part. So shifting consumer habits and competition from online retailers also had a negative impact on Walgreens profitability. But, I wanted to say it's not like they haven't tried to make it work. A few years ago, they made this move. A lot of retail pharmacies made a move toward healthcare delivery. Walgreens invested in a company called Village MD, which was this chain of primary care practices that were co-located at some Walgreens stores. And that business model has really struggled to turn a profit. Some of those clinics ended up closing too. And so now Walgreens is really hoping to pivot back to its core lines of business. That's primarily pharmacies and specialty pharmacy services.
Yeah. So when you were looking into this research, like just still focused on Walgreens right now, like I believe the idea was like this healthcare as a loss leader or like discounted candy as a loss leader where you'll go in, you'll get your bag of candy, you'll get your flu shot. And then also while you're there, maybe you'll pick up some stationery or other home and goods, crazy glue, whatever. And that's turned out to not work out so well so far. Is that kind of what we're seeing?
Right. Yeah. I think, what happened with Walgreens, with Walmart is kind of a cautionary tale for other retailers. This idea of pharmacies being, one-stop shop, meet people where they are. Kind of healthcare hubs hasn't really caught on in the way that people thought or maybe hoped that it would.
And then kind of moving towards CVS now, they've also pared back on these kind of efforts. They've had the health hub, speaking of hubs, and that's turned out to not work out so well. What's been going on there?
Okay, so CVS is really interesting, actually, and I think they are kind of an exception, and we'll kind of get to that later. But so pharmacy services are the most profitable segment of CVS Health, and the revenue that they bring in from prescription drugs is, it has them performing better than a lot of their competitors, but they're still facing, similar pressures in terms of reimbursement rates and consumer spending on the retail side. Compared to Walgreens, though, CVS has really pushed further into healthcare with mergers through Aetna, that's their insurance company, and Caremark, which is their pharmacy benefit manager. CVS has literally spent tens of billions of dollars on acquisitions in the last 2 decades. So, CVS has kind of its legacy retail pharmacy operation and a health services segment that has the PBM. But so to your question about scaling back, so what they found was that it's the insurance business, and specifically higher than expected medical costs in Aetna's Medicare Advantage plans that has CVS looking to cut back, including one of the other headlines that was out there, last week or the week before, is this possibility of maybe splitting the pharmacy chain from the insurance business. But I think that seems more like kind of a thought experiment now than, right now, as opposed to something that's likely going to happen.
We don't have to go too deeper into that, but that is interesting you raised that, since CVS bought Aetna as an insurance and now already potentially talking about breaking up, which makes me wonder if they're looking to, farther out into policy regulations of like where antitrust could go or something along those lines. Not having to get into that today, as purely just speculation.
Yeah. So CVS, this is, I just did a deep dive, and this is really interesting, but CVS has other assets too that would come into play if the company moves forward with that kind of breakup, like Walgreens. So I want to bring this up, and then we can talk more about kind of the retail clinics. CVS also started opening primary care clinics next door to its retail pharmacies through a company called Oak Street Health. And unlike Walgreens, whose primary care clinics we just talked about, they've been underperforming, CVS seems to be generating a profit through Oak Street clinics, and doubling down even on primary care kind of at the same time that other retailers are scaling back. And there's, different reasons for that. But I just thought that was an interesting contrast.
Yeah. And one thing to note about Oak Street Health is, if I recall, the customer base for that is strictly like Medicare populations, right?
Right now. Yeah.
At this time.
I think they're in a unique position. They have kind of a stronger competitive advantage over other, pharmacies and drugstores that kind of gives them the ability to scale and test, different service offerings.
Yeah. Last time I checked, we weren't employees of LeeRink, but it does sound like maybe a diverse portfolio might help them in this regard.
Yeah, that went over my head, Jeff.
Yeah, that's okay. That's okay. Going back to the health.
Yeah. So I think I'm okay.
No,
so
it was good.
Healthcare has been it's been a really difficult industry. So I know a little bit more about what we're talking about here. So healthcare has proven to be a really difficult industry for retailers to navigate and, call it scaling back or whatever. A lot of companies exited the retail health market really fast. And, to be clear, I think what we're talking about is mainly these sort of in-store clinics, right? That seemed like they would be kind of a sensible extension of the retail pharmacy business.
Yeah. So, what can you tell us about Walmart Health? I know a lot of the news has already happened earlier this year with that, but it does dovetail into this conversation about the health of retail clinics.
Yeah, so they Walmart announced that it was closing its health centers. It took a lot of people, I think, by surprise. But building a retail clinic model around primary care, like a lot of these retailers have tried to do, is really hard because primary care has such a low profit margin in the first place. And I've mentioned reinsurance, reimbursement rates. Those tend to be really low. Inflation over the last several years really affected the price of medical supplies. And this is what you were saying earlier, if you can't offset your losses through the business that you do as a pharmacy, then you really, and you don't have a steady volume of patients or shoppers, it's not going to work. So, yeah, a lot of companies have moved away from investing in their healthcare clinics, in their retail stores, but I think the opportunity to kind of experiment with different models is still there, especially in rural and suburban areas where those clinics really do serve an important role. And I was surprised to learn this. So, believe it or not, those rural areas actually represent a geographic segment that retail clinics haven't really tapped into. The vast majority of clinics are retail clinics are in urban areas, in big cities, places like Chicago, Atlanta, Dallas.
As a quick aside, the case study of Walmart Health might be really interesting to read about in the years to come. When I was a reporter at Healthcare Dive around 2017, 2016, you really saw them ramp up their messaging in healthcare. And then I can't remember the exact date of when they announced the advent of Walmart Health, and maybe they had some other stuff going on in the healthcare space before the advent of Walmart Health, but it seemed to not work out as they thought it would.
Yeah, it seems like a recurring theme here.
Yeah. And I'm not going to say whether that's a bad or good thing, but it was kind of interesting from just like if a company is trying to make a play in healthcare, the long ramp up and then, the actual execution looked to be interesting. But moving on about, those are the repercussions of people's actions or of a consumer's actions. Looking at these stories, what does this say to us about how someone can strategize versus the actual behaviors of consumers?
Yeah, and going back to, I mentioned I was surprised to learn that most of these retail clinics were in urban areas. I think part of the strategy there, standing up a retail clinic in cities makes a lot of sense if you want to reach as many customers as possible. That's like a very sound business strategy. But I think one of the bigger missteps here is that these retailers thought that their brand would be enough and that people don't have enough access to primary care and would therefore be willing to visit a provider despite not having a personal relationship because Walgreens makes it accessible and it's convenient. But I think healthcare consumers are a different kind of consumer, and getting your care in a retail clinic, let's be honest, can feel a little transactional. And I don't think, most retailers haven't really figured out a way to design a retail health model that moves beyond just fee for service, that truly integrates primary care, builds trust beyond just customer loyalty, and keeps people coming back.
Yeah, and that's even before getting into, there were a lot of studies or not generational ideas. There were a lot of prevailing wisdom that millennials who are now getting older would have more healthcare needs. But during that time, about 10 years ago, millennials didn't have an interest in having a primary care physician relationship. I'm not sure what that literature or research is today. If someone does know that, I'd love to hear from them because I would think that's interesting. And then even if you do have that relationship, getting into the primary care clinic when you actually do have something that you want to have checked out has been challenging, whether it's a physician's shortage, if you want to call it that, or if just the clinic has too many patients to get in soon time. So at a quick time, it can be challenging.
Yeah, and I think Health systems feed patients into specialty care and surgical services in a way that, retail clinics simply can't. And I think the reality is that retail clinics meet the needs of some, but not all patients. And I was going to respond to what you said earlier. I think, people, patients, consumers, I really feel like we're all wanting this more integrated experience. And I think you're talking about millennials. I think for various reasons, many of us are a lot more discerning about our care now.
Yeah, I mean, I also think from debatably, I'm a millennial or not. So for what it's worth, some Pew studies tell me differently depending on the reading of the report. But it took me 2 weeks to get into a primary care, visit after needing one. So
right, that's not too bad, right?
Yeah, it wasn't too bad. But at the same time, I could have gone to urgent care for the same issue, but it would have been different on the copay. So you got to weigh that stuff as well. As a consumer, how much is your time versus your money? So what do these actions say about how consumers, we've been talking about how consumers utilize healthcare services. Is there anything else we can talk about when it comes to that?
Yeah, I think I'll just respond to that question by sharing some ideas that I have seen out there from different industry pundits. And the first is that, if we build it, they will come. That approach seems to have been deeply flawed here. Second is that strength in retail doesn't always translate into healthcare. And third, to really succeed in value-based primary care, you really need a more stable, I've been talking about it all day, more stable reimbursement model on the policy side. But you also need to offer those longitudinal supports for patients, whether that's through virtual care or some other type of delivery, just depends what you're comfortable with. So I think retailers are going to continue looking at ways, kind of probing these questions. What do consumers want? But also looking at ways to leverage their brand as an entry to primary care. And I think we've learned a lot about what hasn't worked. And so it's going to be interesting to see kind of what that next era of retail healthcare looks like.
Yeah. Well, Leslie Erdelack, we'll have you back on the pod to discuss Amazon, since we didn't even get into it.
Please do. Yeah.
Well, fantastic. Leslie Erdelack, thanks again for joining us today on Health Affairs This Week. And to you, the listener, hope you enjoyed this episode. Please subscribe and send this episode to a friend. Thanks, everyone. See you next week.
Thanks, Jeff.